Welcome to Mind Pioneer, the podcast where host Scott Donnell interviews experts in health, wellness, and technology.
Hey everybody, Scott here. Welcome back to another episode of Mind Pioneer. We're very excited to have our guest today. She is Shaliza Shorey, Dr. Shaliza Shorey. We're gonna have an incredible conversation. She's a licensed psychologist in California. She is the co-president of the American Association of Pain Psychology, AAPP, and she is the founder and CEO of Epiphany Corporation. It's Epiphany, AEpiphany, if you're trying to look up the domain. Epiphany Corporation. Shaliza, welcome to the podcast.
Thank you, Scott. Nice to be here.
We're going to have a great conversation. I want to talk about neuropsychology. I want to talk about pain psychology. I want to talk about all of the things that are in your brain, because before we started recording, you basically just told me in incredible scientific terms why happy works and why you think it does. I mean, you still have to get the product, but when I explained the technology, you explained it from a neurochemistry standpoint, which to me is rare because most of us, are chemists, and thinking about it from a physical standpoint or a physics standpoint, you're thinking about it from a neurochemistry standpoint. So give me a little bit of your background here. What led you into this? Why neuropsychology?
First of all, I'm going to start out by even saying what a neuropsychologist is.
Okay, good.
When I meet people, they're like, well, what do you do for a living? They've never heard of it. So neuropsychologists, basically what we do is we study how the functions of the brain impact our emotional and cognitive functioning. So that's the short of it. And then the other hat I wear is a health psychologist, which is kind of really studying and helping people with the emotional and lifestyle impacts of living with a chronic condition. So neuropsychology, why neuropsychology? I think you and I have this in common. I have a very high novelty seeking quotient, so constantly need to learn new things or find new things. And there really isn't anything else that's more complex than the human mind.
Right.
I feel like in neurosciences, we're constantly humbled. The more you learn, the more you say, gosh, there's so much I don't know. So I feel like I've been working for over 20 plus years. I've been a clinical neuropsychologist, but even now every day I have days where I'm like, wow, I just learned something new. So really that's the reason why I study it. It's fascinating.
Constantly fascinating, constantly learning. Yeah. If you can wake up every day and be excited to learn more, that's what you want to do. That's not a job. That, by the way. That's
no, I agree. I feel very blessed and have a lot of gratitude that I get to do what I get to do, because it's fun. I actually enjoy it.
Living your dream. I love it. I don't know if that would be my dream. I think it's definitely your dream. I think it's perfect for you. I like spending an hour with someone like you to glean as much as I can possibly learn. Okay, so this is good. So tell us just before we go any further, tell us about Epiphany Corporation. So I want to know, what the company specializes in. And then I think our audience just kind of wants to know, what are the main things that you help people with?
Okay. Let me start with the why I even did it, because I sort of want our discussion to be a little bit more educational than just about the corporation. They can go to the website if they're just looking to see what the corporation does. But really, let me help you understand why it's necessary. So when people have a chronic condition, let's say they get diagnosed with chronic pain. So there's this sort of inner circle, right? Well, now when you're having some physical symptoms, that's going to impact your activities. What can you do, both vocationally and socially? So now this little circle expands a bit further out. So now if I'm not feeling well, I'm limited in my activities, it's going to affect my mood, right? How am I feeling about things? It's also going to affect my bodily rhythms, GI system, how I'm eating, weight loss, weight gain, my sleep patterns. And then that further ripples out into, if I'm not feeling well, I'm hurting, emotionally I'm down, who has the bandwidth for relationships? So now it also starts to take over relationships and people are isolated. And we call that the ripple effect in our psychology world. In order to help people who are living with mental health conditions or chronic conditions, we really need a multidisciplinary approach, right? And our current healthcare system, unfortunately, I feel like after 20 years, it's still a frustration for me, is these people don't fit neatly into the system, nor is that our current system meeting the needs of these people.
I think it's frustrating everybody, by the way.
Yeah, I agree. So really why I started Epiphany is to help bring this ripple effect from here, kind of help people with containing it. So we are building a multidisciplinary network. I've got psychiatrists, psychologists, therapists, primary care physicians, other specialists on the platform, because you need the medical providers and the mental health providers to talk to each other. You don't need the disconnect between them. And I think there's a huge gap between the medical and the psychological world. So, and the technology is simple. I have providers who are in their 70s who are using the technology. So it's literally just a HIPAA compliant texting app. So if you know how to text, you know how to use our platform. But what's happening in it is these really rich discussions. So I'll give you an example of some of the things. For example, we had a primary care physician who had been working with somebody who shared with the rest of us on the platform that when this person went on a keto diet, their bipolar disorder really cleared up, right? So we're sort of learning these things from each other. Or a functional medicine doctor who was able to help one of the therapists to say, hey, when you're working with kiddos with anorexia or eating disorders, add a dose of probiotics to their care, right? Because that really can change the game for them.
Yeah.
This kind of cross collaboration is leading to a lot of rich knowledge and discussion. And then the patients subscribe to a doctor. So it's kind of a little bit of a bring your own doctor or bring your own patient model. So you can enter the system from either side. So either a provider can come join our network and then their patients are subscribing to them. And our multidisciplinary network is collaborating, sharing, giving them tools. Or a patient can say to their provider, to their therapist or psychologist, hey, would you please join this network? Because I think my condition could really benefit from a multidisciplinary angle.
Yeah.
They can just go to the website and send us a note. But really the heart of it is in the collaboration. And really second piece of it is that I think we're sort of moving into this world where knowledge for the sake of knowledge, right? There's no shortage of anything you can Google or data currently.
Right.
But knowledge for the sake of knowledge doesn't change behaviors, doesn't change habits. So the platform is about taking kind of that traditional, let me meet you in the office one-on-one session, but also giving the providers the power to be able to go beyond that.
Yeah.
To support patients in their daily life. So the right advice in a timely manner can really keep people progressing with their treatment. So those are the two components, is multidisciplinary collaboration and then kind of out of the office extended care as well, not just during the session.
I love it. Knowledge to change behavior. That's so good. We have a world that is, I heard this stat the other day, all of the knowledge and writing and information that's ever been created from the dawn of time until 2003 is now put online in form of content every 48 hours. And that is insane if you think about it. So there's no way to keep up with 1/1,000,000,000th of what's going on in the world.
And other stats that's, interesting kind of with that is while we have all this knowledge, believe it or not, I recently read this, that only 50% of all research makes it, is only seen by editors or the underwriters. So more than half of the work that's actually being done that's evidence-based is never reaching clinical practice. So wow. The things that we're trying to do is let's take these evidence-based tools, put them in kind of these bite-sized pieces,
right?
Get them to the patients in a way where they're now living and doing something differently.
Right. Make it, this is almost like your own version of AI. Like you're learning as you're going with a group of people so people can get the information they need. I think it's brilliant. I love the model too. And I think it's holistic mental health at its best. It's all connected. You're right. Like chronic pain expands to mood, expands to your GI system, expands to your sleep problems, expands to emotional and relational health and isolation or unhealth and isolation. And it's all connected. If you think that a pill is going to fix your life, it's not.
Yeah, and I think one of the other things that's really hard for people when you do have all these multiple needs is finding good vetted professionals is really tough. So, one of the things we're trying to do through Epiphany is take that burden off the patients and the providers to try to now run around and figure out who can they see for their physical health needs, who can they see for nutrition, and who can they see for this or that. So by kind of collaborating, you're also making that process really easy for people to just find vetted providers that can support them with their different needs. And yeah.
Wow, that's so good. I'm excited. And I know you mentioned too, before we started recording, that you're big on wearables and feedback, right? Real-time research, real-time feedback, real-time learning.
Yeah, so
I am
as a
in the same boat.
neuropsychologist, sorry.
I'm in the same boat. Yeah. I mean,
Yes, I
we're both,
know.
I have an Aura. I use a Whoop. I had a constant glucose monitor up until a couple of days ago for the last several months, tracking me 24/7. I wear Happy at least 5 hours during the weekdays, and then sometimes at night for 8 hours to get a good night's sleep with deep REM on my Aura stats. So, you know, that's, I think, getting evidence-based and research-based therapies is the most important thing. And I think you're trying to crowdsource it with your community, which is brilliant.
Yeah, because one of the things is, that I always say to my patients, if data alone was going to change our problems, then the scale should have solved America's obesity problem. Okay, but it didn't. So yeah, while the Apple Watch, the Fitbit, and I don't have my Fitbit on today, but I do wear it as well. While we now have these devices that can give us a lot of good information, if we don't teach people how to take that information and then better their lives, it doesn't go far. So as somebody who teaches neurofeedback, biofeedback to my patients, the goal really, the saving grace for America's healthcare system is going to be to help people become self-efficacious with these chronic conditions, empower them so they don't have to keep coming back for that script from the doctor. Right? It's that same concept of teach them to fish.
Yeah.
So by patients subscribing to their doctors, what they're getting is these tools that sit on the app in their phone, and they have access to it, and they're kind of practicing them, and the doctors are keeping them accountable. It's that, that's why people have personal trainers. It's that accountability, somebody that I trust keeping me accountable, and also just there to guide me when I get stuck. Because some days motivation is hard. Some days we're not clear on what to make of that data. So yes, I do have my patients text me their data from their heart rate variability, their sleep numbers from the Aura Ring, as you said. That's a really fantastic product. And we work with, okay, now how do you use this data to actually get some relief in your life?
I love it. That's so good. I think the world is going to get more sensors, more data points, more triggers in technology to be able to give people more control of who they are, how they're feeling, metrics on their body that they wouldn't have known any other way. And I think getting it in a cost-efficient way is crucial, right? For a couple $100 or a few bucks or even for free, how do you get certain data points that you can, our dream, for instance, with Happy, long term in the next several years, we want to create a biometric feedback system where we can pull in data from Aura, pull in data from our own bed form factor that's tracking your sleep at each night and saying, okay, hey, it looks like you need some energy right now. Can we help you with a caffeine signal, with an alert signal? It looks like you're stressed. We have a de-stress signal, let's help you do some meditation. We got a signal that can help you like imitate the effects of CBD or whatever it would be to help you and get into a relaxed state, right? That for us, it's automated therapy. Like it was like the best of all worlds, right?
Well, what I'll say to that is the automated therapy works once they have the foundation, right? And that's where I sort of like the combination of, even with, I think one of your questions that you and I were talking about is, why do I sort of advocate for these other interventions aside from just pharmaceuticals, right? So while pharmaceuticals have a place for certain conditions, the fact of the matter is people do develop tolerance. And especially for the younger folks, once they develop tolerance, it's really difficult to get them to continue their progress. But the other thing is, Scott, that the devices, the data, and pharmaceuticals don't teach you to sort of look at your deeper patterns, your subconscious habits that are getting you in trouble. They don't help you explore your psyche in the same way. That's where a provider comes in, a trained provider who can help you with healing from past trauma, who can help you with changing behavioral patterns that are holding you back. So augmenting your care with this data and some of these other things can be there, but I think our society is going a little too far with, oh, all you need is telehealth.
Right.
There's still a place for meeting with somebody in person and discussing those deeper subject matters But yes, at the same time, you can really empower people to start taking charge of their own well-being as well. And I just think we haven't combined that. So my whole Epiphany's whole model is hybrid care.
Yeah, I think there's a form of hybrid is where we're supposed to go. I agree with that.
Yeah.
Now let's get into that sauce. So what's your method? How are you helping your patients address their psychological issues? Like what are some, or empowering them, right? Give us some kind of tips or talk to us just about the method that you use.
I'm huge on tiny habits. Stanford had done a
BJ Fogg.
yeah.
BJ's been on our podcast before. So
yes,
I love
it's a phenomenal model and principle, and I wish more people would use it because I think too many doctors overwhelm their patients. They will prescribe workbooks. They will prescribe all these handouts. They will give them 10 different things to do at once. And when you're already dealing with pain and fatigue and mental fog and not sleeping well, those works are too much. Those workbooks are too much.
Yeah.
So tiny habits is my main thing. When I first work with patients, the first thing we look at is starting with the nervous system. Do you have hyperarousal? So those are going to be our folks who are having anxiety, OCD, insomnia, right? Or do you have hypoarousal? Do you have too much of the parasympathetic nervous system? So you're kind of feeling vegetative, not getting motivated, not being able to get up and do things, right? So we first start out by just kind of looking at that piece of it. So while via the app, I am guiding them on how to better regulate the nervous system. We use things from heart rate variability, and so that's where some of the data comes in, and kind of guiding them with that to balance their nervous system. And while they're balancing their nervous system, I'm also having individual sessions with them to look at the psychosocial stressors in their life, right? So, I mean, there's the whole biopsychosocial model is what we practice as health psychologists. And so we're doing that deeper work of the real substantial stressors on them to help them work through those while we're balancing the nervous system. So how do we empower them? Just that. Don't overwhelm them. One step at a time. And you're there to guide them with the tools. It's not just like, hey, go home and practice these tools. You're all on your own. I'm right there. When my folks get stuck, they can text me and say, hey, Dr. Shorey, I tried this, but I felt like my anxiety actually increased. Because believe it or not, when people first start to relax sometimes, the nervous system's not used to it, right? If they've had pain for 10, 15 years, their nervous system says, what is this? So they can actually feel worse initially. So to be there, to guide them and provide that hand holding, then they don't sort of give up on the treatment. They actually stay with the treatment, right?
Yeah. Yeah. This is good. In fact, I know I can tell almost when I meet someone, they have like a clinical personality or like mood or ambiance around them. I start to relax my own body, right? I mean, I'm almost yawning a couple times in this not because you're boring, because you're fascinating. It's not that at all. It's because your presence actually calms me. Like I have zero stress right now. We're just having a nice conversation. It's funny. It's just hilarious because every time I sit with my counselor, he's like, I yawn the whole time because it's like the first time my body kind of settles down after running so many companies and going so hard.
You're having some transference of the.
I definitely have transference. I definitely have it. I feel it. It's a good feeling. Don't worry. I love this. You have a very calming presence. Now I know why you do what you do so well. So, okay. I feel like one of the things you mentioned just about people taking more control of this for themselves. So much of Western medicine, at least, not Eastern medicine, but a lot of Western medicine is, I hurt, I go to doctor, they give me pill, I move on. The problem of that is it might help them in the short term. A pill can help someone, a prescription can help someone. Yeah. The problem is when you continue to create that, reward system, just a quick fix type idea, you remove the actual care from the individual being in charge of themselves. Right. You put the onus on the medical system, and then it becomes more reactive instead of proactive. It becomes only when there's a nightmare will I then think about my body and my health. This is, we're in the health world, we're in the mental health world, the physical health world. Like to us, it's like crazy now how you think that way, but most of the world still thinks that way. It's like, I'm just going to do whatever I'm doing. I'm going to get by each day. live my life however I can get, do it, self-medicate through drugs if I need to. And then when things hit the wall, I'll go see a doctor and they'll fix me up. And I think what you're talking about is trying to shift the onus from, reactive to proactive. You want to get people to take control of their health and realize that all this stuff is deep down in our bodies. Our traumas are deep down in our bodies. Our bad habits, our childhoods, and all the things going on inside of us, they're deep down in there. And they need to be brought out, and they need to be constantly worked on. Like, it's a way of knowing yourself. It has to be a way of life. And listening to yourself has to be a way of life. Checking in with yourself has to be a way of life.
Well, and there's a science behind it, right? So basically, there's a fantastic book called The Body Keeps Score.
Yes, I love that book.
Yeah, and so the idea is we're not that different from computers in the sense that everything we've experienced throughout our life is programmed in our nervous system. So therefore it continues to, and there's an efficiency to automation. Obviously, that's why we're living in a world that's trying to automate everything. And our bodies and our minds also try to automate. So if I learned something early on in my life, my body and mind are still going to try to keep taking care of it the same way. But now that habit or that pattern may not be as effective for me. It might have become obsolete for me. So I need to sort of update the system. So kind of these working with the providers is about learning skills for updating your system, so to speak. But yes, it's nothing, we've put so much stigma around it, but there's really no stigma. It's just how we're all wired. Our nervous system is going to be programmed with everything we've sort of come in contact with, right?
Yeah.
And I think around the pills, what I'll say is that, yes, in certain conditions, they absolutely have a place. But yes, we're becoming a society of convenience. This is where I, as a behavioral psychologist, have an uphill battle because it's much easier to swallow a pill than to, change my habits or practice something. But I say to my patients all the time, I say to them, if you bring home your prescription and that prescription bottle sits on the shelf and you don't take the action of swallowing the pill or putting on the patch or whatever it is, will you get the benefits? No, I have to actually do it.
Right.
Right. Then why do you expect benefits from the behavioral stuff without doing it, right? Even your little headband, if it sits on somebody's shelf, well, it's not going to really help them.
Right.
So we have to think about the fact that we have to take the action with the behavioral skills as well. We have to practice them because even the pills, even though they're more convenient, do not help people unless they take the action of actually taking the pill. So you have to take the action of practicing the behavioral skills, and then they do work. They're very effective.
Yeah. Oh, that's good. That's so good. Okay. So what's your favorite part? What do you like best? I mean, tell me, like, what's your, I know you can't give out patient information or anything like that, but what is the best, most rewarding part of what you do? And people listening out there, give them an idea of what's kind of possible for their lives if they're struggling.
The best part of, I think, what I do is I don't have to make small talk. All day long, I get to go and we are in there talking on a very authentic, real level about things, whether it's trying to help figure out somebody's mental health diagnosis or working with them on some of these things that are getting in their way. It's really an honor, right? So when you show up, I live in Silicon Valley and have a lot of friends who are in the tech field. And sometimes we'll get into these arguments and I say to them, I know why I wake up every morning. I know exactly why I'm going into work. I mean, I've had many people say it's not an exaggeration to say that I wouldn't be here today if there wasn't for our work, right? That feels fantastic. I know my purpose. I'm very, very connected with my purpose for why I'm doing what I'm doing. And I think that's what's nice. And it's nice I do think that patients should expect their providers to be present with them. I think a lot of healthcare has become the doctor charting as they're, meeting with you. And I don't blame the providers at all. I think we're in a very maxed out healthcare system right now, mental health system. But I really just want to teach people out there who are listening, who are living with chronic pain or mental health, advocate for yourself. You do know what's happening with you, right? There's this power difference. You go into your doctor thinking they're the expert, but you live with it every day. You have a certain amount of expertise on what's happening with you. You are the expert on what you need. So really, I want to empower people to say, go in, have an authentic discussion, be honest about what's happening with you and expect them to show up and listen, because that is what healthcare and mental health is about.
Is there a trick that you have or something that you could tell someone right now that would get them to move over that action line that BJ Fogg talks about for tiny habits, right? Motivation, ability, prompt, get them over that action line. Because I mean, a lot of people here, it just feels like they hear what we talk about, they hear what you're saying. It's like, okay, when things get bad enough, I'll call you, you know, when my life's in chaos or tragedy or turmoil or something bubbles up and, you know, I'll call you. What is one thing that you can encourage people? You know, it's good to be in charge of your own life and be an advocate, but again, that's someone who's already gone to see a doc because they're really in trouble. What can you say as someone who's not in trouble, but they're just sort of in the middle? Like life can be incredibly powerful and a beautiful thing, but what do you have to say to them?
Well, I think you said it earlier. Prevention is always better than rehabilitation, right? So we've become a society again where there's reimbursement for rehab and only one wellness check is covered per year, whether it's for our children or ourselves.
Yeah.
But if you're on the fence and you're like, well, it's not so broken right now, it's not so awful, but yeah, I'm noticing certain things, don't wait till it's awful. It's always easier to fix a small leak when it's still small as opposed to, gushing. So go in when it's a small leak and get the support that you need. And don't try to think about 10 steps down the road, because then I think people overwhelm themselves. How about we just start with that one appointment? Just make that one call, that one connection, and then you'll have choices from there. And then just see, right? Even for young people, sometimes I will see people all the time. Well, I'm not sure if I should do this, and they're thinking 10 steps ahead. And sometimes when I'm sort of talking to younger folks with career issues, I say to them, no one's offered you the job yet. So why are you contemplating, well, I don't know if it's going to fit with my schedule and the commute is too long. Just at least apply. Learn to interview, get through step 1, get through step 2. And then if you get offered the job, then you have choices and you can decide what's happening for you then. I think we overwhelm ourselves by overthinking it. So for people who are noticing certain things, and especially for the last year during COVID, but we sort of talk about how in our world, solitary confinement is the ultimate form of punishment.
Yeah.
I actually used to work in prison systems when I was an intern way back in neuropsychology. We've all been in some form of solitary confinement for the past year, and we're feeling the effects of it, whether it's in our sleep rhythms or anxiety or overall mood. Go in if you feel like, gosh, yeah, it's taken a toll on me. The last year has taken a toll on me. Go get whatever support feels right for you, but fix it when it's still a small issue.
I like that. Fix it when it's a small issue or it grows to a big one. Yeah. That's good. What about people who have these mental health illnesses, right? I know people who deny it. I know people who have depression and they deny it. I know people who have bipolar, they deny it. I know people who have insomnia and they don't even call it that. They're like, sometimes I just struggle to sleep. I'm like, no, you sleep 2 hours a night. Like you have insomnia, or you don't sleep for 3 days in a row. You have a problem here. Same with eating disorders and things like that. So what do you do in those situations where someone just denies that they have it and they're like, that's not me. There's no way I'm in that category. I don't have to go see a shrink or, whatever the words that they use because they want to minimize the value that they're going to get from a clinical psychologist or something. What do you do in those cases?
Well, this is why I'm building what I'm building, is because yes, there are times, whether it's because of somebody's own cultural background. I mean, I come from a culture where they're like, what? I had uncles and aunties when I was trying to apply for graduate school who said, what are you doing? Why don't you put medical school instead? What is psychology school? Like, are you going to waste your time there? So we have cultures that don't acknowledge mental health. And then we have other stigmas within our own families that can sort of say, well, no, that's not really that. But this is where the Epiphany model that we're building, there's no wrong door. So somebody can present to their primary care physician. And a lot of the primary care physicians I'm working with right now are saying, 70% of what we're doing going door to door right now between patients is hearing mental health issues. And that's okay. So even if they're talking to their mental health provider, now their primary care physician can reach out to a person like me or somebody else and say, hey, I saw this patient and I suspect they are struggling with depression or insomnia, as you said. do you have a quick screen or something that I could even just do with them to help expand that awareness a little bit? To say, hey, look, your numbers are not in the normal range, and I can send them something so they can start that discussion. I've put a whole insomnia program together that I share with the providers on the platform, again, in bite-sized pieces. You know what? Have your patient notice X for this week and have them report back to you about what did they notice. So there's a whole model, I don't know if you're aware of it, readiness to change.
Okay.
As long as we don't get judgmental about people, we're all going to be at different stages. Somebody's ready to come in and be like, hey, I acknowledge this, I'm ready to work on it. And other people are not even aware that they have an issue, but their whole family's throwing up their arms.
Yeah, right.
And that's okay. For the ones who are not aware, if a primary care physician, which is oftentimes where we first present, is our pediatrician or primary care physician, most people are going there, bridging that gap between mental health and medical world and primary care, we're helping kind of support those doctors in being able to say, okay, let's look at this first, and just slowly expanding that awareness. And that person may be ready 3 months down the road or 6 months down the road, but it's okay. Starting with them wherever they are is actually the way to start opening the door.
Yeah, that's great. And I think if people are denying it for themselves, maybe they're thinking about it for somebody else that they can help. And in the process, they'll discover we've all got things we got to deal with. And it shouldn't be a stigma. It should be just like going to the gym, just like, going to the produce aisle instead of.
Well, I'm hoping that we'll move there because I have a friend from Argentina who says in Argentina, everybody has a therapist. I mean, I don't know if that's true or not, but basically I think there are certain cultures where just like you have a personal trainer, it's actually okay to have a mental health provider who helps you keep an eye on your overall well-being from an emotional perspective. So I'm hoping we'll get there as a society at some point.
That's good. That's good. So if you as Shaliza or Shaliza, I want to make sure.
Shaliza.
Okay, I got it right. If you could get into a time machine and go back 20 years, what's one thing you wish you would have told, you could tell yourself then from now? What's one thing you wish you would have known then?
Well, I think it would be, I didn't realize how much, how little we prioritize mental health in our society. I think as a professional who's grown and I've worked in inpatient settings, I've worked in hospital settings, outpatient, now I'm in private practice. The funding cuts in all of these settings are almost always in behavioral medicine and in mental health, right? Because maybe they're generating the least amount of money for the hospital systems or the healthcare system. So if I go back as a professional, as a young person, I don't think I realized that, gosh, it's always an uphill battle to try to secure your funding, to try to get resources for people who have mental health or chronic conditions. And that lack of funding, that lack of acceptance in our system to say this is important makes it really tough. So, your reward becomes still the work you're doing is rewarding, but it's frustrating when you are working in a system that doesn't prioritize mental health.
Yeah, or could it be that those in charge or policymakers in politics lack the most emotional intelligence and mental health? And narcissists might cut the budget because they don't think it's important.
Yeah. So I think that sometimes gets frustrating because you see that, gosh, it doesn't even have to take much. Like I'm saying, right? What are we doing on Epiphany? Enhancing direct communication between patients and collaboration. It's not about, you can save your chart notes, you can save your chat to your chart notes, that's fine, but it's not about charting. And yet we've created a whole healthcare system where the doctors get paid for all the codes that we can write down, not for direct communication, not for direct patient care. Those things are frustrating.
Yeah, absolutely. Yeah, we could go on for hours on just this topic, but I would love to know the best advice you've ever been given.
Well, we live in an age right now where it's all about social media and popularity, right? And I think the best advice I've been given is don't worry about trying to become popular, try to be useful. So, I'm really hoping like even our discussion today, people get a sense of this whole ripple effect that I'm talking about as to why and how is it that mental health and chronic conditions take over a person's life and that it's a real phenomena. Let's not make those people feel weak or isolated, right? So I think the best advice sort of I try to hold true is I'm not so worried about trying to become popular, but hoping to continue to be useful.
Yeah, that's good. That's really good. I think that was probably the best advice I've gotten too. Be useful. Help.
Because I think especially in this journey, I've been learning a lot. You know, I ran a private practice for 20 plus years without even a website. And now that I'm trying to do something and get a message out through Epiphany, people are saying, where's your LinkedIn? Don't you have Instagram? Don't you have Twitter? Don't you have Facebook? And I'm like, no, I don't have any of that. So it's been interesting because I think I often find myself saying that when we're on these social media platforms, in some ways, we are bragging about ourselves.
Yeah.
Fully, you know, if we're doing worthwhile work, that to me is time better spent in some ways. So
yeah, be useful, serve. I think being useful and serving other people is one of the best therapies against mental health issues I've ever seen. Helping people is one of the best ways to regulate. And
good for our own nervous system too.
That's right. That's right. So you did ask, you know, you said you're not on much social media, but where can people find you? Give us the site, the website, or any sort of social that we can find you.
Well, here, I'll just type it in the chat. They can go to Epiphany's website and they can learn a little bit more about me there.
Say it for the thousands of people that are going to listen on the podcast. So it's AEpiphany, .com.
Yeah.
So
and then also, if they want to send me a direct message, they can go to my Psychology Today profile. That's psychologytoday.com. For my private practice, I have a little blurb on there that I put up a long time ago, but at least those emails will come to me directly.
Awesome. All right. Well, Dr. Shaliza Shorey, you're wonderful. Thank you so much for your time.
You're welcome. And it was a pleasure talking with you, Scott. Thank you.
Yeah, it was great. And just so everyone's clear, it's Epiphany with an A. So AEpiphany.com. Head over there. I think this was an amazing discussion. And I think there's so many people that have trauma, have issues, have chronic issues, and there are a lot of ways that they can be helped. And I hope that people listening right now will know that you don't have to deal with this your whole life. There's a lot that you can do to make your life better, and you can do it now before something blows up or something breaks for good, right? So thank you again for your time. Thanks for the audience for listening, and we will check in with you guys on the next episode of Mind Pioneer. Take care.